is Arne Burssens. I'm working as a resident in orthopedic surgery at the University Hospital of Ghent with a special interest in foot and ankle surgery. I think the weight-bearing CT should be involved in the foot and ankle practice because it delivers much more insights as before. The more we're using the device, I think the more we better understand the pathologies. There are a lot of pathologies that are revealed now on the weight-bearing CTs. Before we had our X-rays, but the problem was we could assess some basic aspects, but we could only assess it in two planes. In our practice, we started using the weight-bearing CT for the hindfoot first. We're looking more at the midfoot, at sprained lesions, for example, the Lisfranc injuries. But even more and more, when we look at it, we see that it's very useful too in forefoot surgery. So before we mainly focused on this arthritic deformities, but when we see it in the forefoot, we notice this important rotational component that we know was present because it's a clinical finding. You see a pronation of the hallux in a hallux valgus deformity, but of course, using the plane radiographs, you could only assess it in two planes because we know that some of the patients that we currently operate in, they do have hallux valgus that returns after some years. We do not know yet how this comes. Mostly it's because of the reduction. It's not perfectly that the head of the metatarsal is situated on top of the sesamoids, but it could be other reasons. And I think it's now becoming clear, but before on the plain X-rays it was really difficult to assess that rotational component. You had the skyline view, but even then it was still not always that the patient was situated on the same correct place in the radiology department. And this is important to have this accurate measurement of your hallux valgus angle because our treatment is relied on that. We look at the deformity in our hallux valgus and we say, okay, this patient has so much decrease of deformity, we do this type of surgery, and for this kind of deformity we do this type of surgery. So it's really important to have that correct angle in advance, and now we have the weight-bearing CT, we can really measure it accurately in the three different planes, and we have that rotational component that we can now easily measure. It's not only something we use, but it's published in the literature. They have a very nice classification based on the sesamoids, where you can really see the subluxation compared to the metatarsal head. So this will certainly give us insights into currently surgical treatments that we use that are for some kind of deformities quite exhaustive. For some kind of deformities they were okay. They were not that exhaustive. They only needed translational osteotomy. But of course, when you look at what we saw from the weight-bearing CT, you know that you correcting only one part of the problem. You correct only the deformity in the axial plane, but you leave behind that rotation. And this was very interesting here on the AOS meeting in New Orleans. It was clearly shown by the foot and ankle specialists here that even without doing huge translations, but by really correcting that deformity, for example, by an osteotomy at the base of the metatarsal one, that you can even have a complete reduction of your metatarsal head on the sesamoids. It was really impressive to see these results, and I think we should work further on that subject using the weight-bearing CT.